I'm delighted to be able to introduce Robert Herzog and his company eCaring, which has created a magnificent platform for enhancing communication and care management between patients and their providers. Robert developed this product because of his frustration at being unable to communicate effectively and seamlessly with his own mother when she was elderly and living at home. But in the process, he has created a product that has the potential to significantly impact issues that doctors and others have struggled with for years, decades, and have no solution. Some ideas, but no real solution, which is, why is the cost of quality so high, and why is the quality of care so mediocre? Now, we could spend 2 weeks talking about that, not just 2 minutes. But what's important is that Robert's product has revealed an area that's often been ignored or overlooked, namely the ability to monitor patients in their own homes. Why is that important? Well, think about it. Most patients, whatever their disease, spend the vast majority of their lives not in contact with the healthcare system, but at home. An average patient might see their doctor for 10 or 20 minutes every 1 or 3 months. Not much time at all. The rest of the time, they're at home doing whatever, but certainly not connected to the healthcare system, and wouldn't it be nice if they could be? So why is this important? Because we know from many studies that patients frequently do not follow the instructions given to them by their doctors, whether it be an office visit or following hospitalization. The reasons are complicated, another 2-week discussion. But it deals with issues like stress, intimidation, confusion, cognitive impairment, financial restraints, those kinds of things. Wouldn't it be nice if the healthcare professionals could connect with their patients frequently and regularly and be able to monitor what's going on for all patients, but particularly those who are suffering from chronic medical illnesses? And the most recent data says that at least 50% of seniors have at least one chronic medical condition. Why would you want to monitor patients at home? What would you monitor? Well, you would monitor whether they're taking their medications, whether they're following diet and exercise advice, and most importantly, whether they have early evidence of relapse of their disease, symptoms that they may not recognize and leads them inevitably to the emergency department. So that's the promise, as well as patients being comforted and feeling secure and pleased because they're connected to the healthcare system. That's what eCaring offers, the ability to do all of that. One anecdote, when I was at Beth Israel Medical Center so many years ago as the chief medical officer, I started a project aimed at reducing readmission to hospital for patients recently discharged with congestive heart failure. And we used eCaring to help us connect with the patients. The results were dramatic, a significant reduction in readmission need. Why? Because we kept contact with patients and identified early symptoms of relapse, edema, shortness of breath, cough, and intervened to avoid the admission to the hospital. And eCaring has shown the ability to do this in many other settings. It's a fabulous product. It has the potential to transform healthcare and improve the quality of lives for patients suffering from these conditions. Let me invite Robert to tell you all about it. Thank you.
That pretty much sums it up. I don't have a lot more to say, so maybe I'll go under my 7 minutes. As you all know, healthcare organizations today increasingly are rewarded for good performance and penalized for bad. And to thrive and survive in today's environment, as David said, they must get better information from where the patient spends the overwhelming majority of the time, their home. But to date, systems to effectively generate and utilize timely, useful information from the home have been largely limited and ineffective. And that's the problem that eCaring solves. We enable home care workers, patients, caregivers, regardless of their computer skills, regardless of their language literacy, to enter enormous amounts of comprehensive, real-time information from the home about critical behaviors and activities, vital signs, medication adherence, mental and physical state, and if they're adhering to their plan of care or post-discharge plan. It's one system that deals with all disease states and comorbidities, so you don't need multiple logins, multiple systems to deal with that. And in doing so, it enables the generation of real-time, actionable alerts, which enable care managers to intervene early in the home and keep small problems in the home from escalating to become big ones in the hospital. This is a vital process both for post-procedure and for chronic care management. It provides data that's in context. It's not enough to know that somebody's blood pressure spiked or somebody starts swelling. Well, they're swelling because they stopped taking their diuretic, because they're upset because they're not sleeping at night, because they're coughing at night because there's construction down the hall, and that dust is unsettling them. Armed with that information, the care manager can intervene early in the home and intercept this chain of catastrophe and keep that patient in the home and out of the hospital. And thanks to our partnerships with Verizon and Samsung, we're nationally scalable to provide universal access to these wonderful digital tools for all patients on all platforms. We also enable care managers to triage patients so they can take their scarce resources and apply them where they do the most good. So they can assess who's in trouble and respond to that, and they can also track outcomes to assess best practices across the board for their care management organizations, often working with multiple providers in multiple settings. This fundamentally changes care management from reactive to proactive. And it integrates easily into care managers' workflow, so it's easier to use eCaring than to not use eCaring. We provide analytics for ongoing daily assessment and performance versus the typical once every 6-month call that's used in assessment systems to determine ratings for organizations which affect their revenues. The results have been terrific. In multiple programs with multiple payers and providers, we have reduced hospital and ER visits by 30 to 40%, reduced medical expenses by 15 to 20%. In David's program, we reduced congestive heart failure readmission rate by 35%, saving on average $3,000 to $6,000 per member per year in these plans. This is a plan that we're working with right now. And here's a plan where we've been able to treat in the home seizures, labile hypertension, uncontrolled depression, avoiding numerous hospital visits, ER visits, and all the costs associated with them, saving them roughly $500 per patient per month, and also saving them roughly 80 hours of increased home care worker time that always comes post a hospital use, saving another $400. We're saving them close to 20% of their total expenses, over $10,000 per year. In that program, the average response time to an alert has been under 11 minutes. 11 minutes to respond to a problem that's arising in the home. This is a revolution in home health care. Versus if you contrast it to a typical plan, which gets information about claims through claims of a hospital visit months later, well after the horse is out of the barn, and there's nothing you can do to have any impact. And by the way, claims data really only tells you what was paid for. It doesn't tell you what happened or how you can prevent it. So we've transformed the home from a black box into a data-rich environment. Now we're a new source of big healthcare data, but data doesn't need to just be big, it needs to be relevant. So we've taken these millions of data points that we generate and filtered them down through our algorithms to roughly 2 alerts per member per month or per patient per month, very manageable for care managers. We've trained over 1,500 home care workers, over 300 care managers, integrated with over 1,500 healthcare agencies. What this means is that for payers and providers, they can reduce their total cost of care, they can get better ratings to increase their revenues through quality incentive payment programs. For hospitals, they can manage their bundled and value-based programs and readmission programs by extending their visibility past the 4 walls of the institution. And providers know that they can successfully participate in value-based and shared risk programs because they know they're going to be successful doing so. They now have this new visibility. For a Medicare Advantage program that has 40,000 patients, a combination of increased revenues and decreased costs for them can affect their net by 20% or so, roughly $60 million for that single plan. We have a recurring business model where we get paid per member or per patient per month for our software and for our client services, and we're also beginning to participate in shared risk programs. I'm happy to announce that we are soon launching eCaring Family Connect. This is a direct-to-consumer version of our app to bring its benefits to the 70 million Americans who are family and friend caregivers, to provide them with a new level of peace of mind. And furthermore, it further establishes eCaring as the brand for home care information and communications. We're fundraising right now to develop our apps, to launch Family Connect, and to build a prompt system to ensure that we get from the home all the vital information that we need. We're strengthening our interoperability to electronic record systems to facilitate scaling up on a larger basis with the large organizations we deal with. We want to add our high-octane contemporary data fuel to predictive analytics engines that depend primarily on historical data and so are quite limited. And we're looking to partner with in discussions with a contract research organization to provide supplemental data for pharmaceutical, clinical, and post-acceptance trials. We also have an A-list people waiting already in the wings to join us once we get our funding. So that's eCaring. We invite you to join us as a partner, as an investor, or both, and help people age in place to live longer, healthier lives in their homes. Thank you.